Dr. Zaheer Shah joins me now. He's a primary care physician treating COVID-19 patients at his clinic in the state of Arizona. Dr. Shah, we really appreciate you taking the time to come on. We know that you've certainly been on the front lines of this pandemic. What have you learned about the virus, and what do you want our international audience to know?
Well, thank you, first of all, for having me. I think that our learning curve for what this virus poses as a risk to civilization is a steep one. What we know to date is that getting it properly tested, aggressive testing, and then socially distancing ourselves one from the other are really the only ways that we have to try to reduce the number of cases that go on to become hospital level and thereby potentially overwhelming healthcare systems. Hopefully, if we can drag this out a little bit, in other words, you might have heard the hashtag flatten the curve, if we can take the number of cases that are going to convert and going to become positive, but extend them out over a longer timeline, it'll give us a little bit more of a lead time to develop containment strategies, as well as hopefully both a vaccine and prophylactic treatment or therapeutic treatment. That's the goal.
Right. We also understand, Dr. Shah, that the fight against COVID-19 is a very personal one for you, being in close proximity to two vulnerable family members, a 90-year-old mother-in-law and your son, who is currently battling a brain tumor. What has it been like for you emotionally trying to battle this pandemic and help your patients while also trying to protect your own family?
Well, when I signed on to become a physician, I came of age during the age of HIV. And when I trained at one of the hospitals in New York, the hospital where I trained, there was a 95% HIV positivity rate. And so as a medical student, I lived every day with the possibility that I could convert to becoming HIV positive because of exposure in that hospital. And that was a risk that I was prepared to take. It's a risk that I think is inherent to the job. We're here on the front lines. We're here to help. And sometimes helping someone else has the potential to pose personal risk. What is new about this pandemic and about the current challenge that we face is that it's the first time in my life, in my professional life, that my work not only could potentially pose a significant threat to my well-being, but could also pose a threat to my loved ones. And that's where the bargain becomes much more difficult. And that's where the idea of sacrifice becomes much more of a challenging notion, because what parent is going to want to expose their child to something that could be potentially life-threatening, or a loved one, an elder who lives with the doctor that potentially could suffer life-changing or life-ending consequences because of that exposure? So this is why, look, we are here. We are dealing with this problem. That's what Americans do. That's what the world has to do. And we have to come up with a solution. I am advocating for my patients as well as for everyone else that I can get their attention that, look, it's not simply taking care of the vulnerable, but the way that this virus is transmitted is vis-a-vis a lot of otherwise young and healthy people who themselves may not have anything more than minor cold or flu-like symptoms as a result of contracting the virus responsible for COVID-19. But in vulnerable populations, like our elderly or like those who have comorbidities, this could be and is becoming a life-threatening condition. As a doctor, I never expected that my livelihood and my professional calling, my responsibility to remain on that wall to protect my patients, could potentially jeopardize the health of my loved ones. And by the way, I am not alone. There are thousands of physicians scattered throughout this great country that are all facing similar challenges, that have family members that are vulnerable. And we are all trying to do the best that we can, unfortunately, under not the best of circumstances. I'm sure you're well aware that the personal protective equipment that goes by the acronym PPEs, there is a significant shortage in this country of PPE equipment, things like face masks. I routinely take a face mask that's supposed to be used only once, and I make it last over several days because I simply cannot access for myself and my staff a sufficient number of face masks and other equipment that are needed to properly safeguard for me from the possibility of getting this virus. And that makes this very painful. It makes it very difficult. It's easy then to get frustrated and angry. I'm doing the best that I can to maintain what I can.
Yeah. You know, you raised so many important points. First of all, the success that we see in terms of the decreased outbreak rate when it comes to social distancing, when it comes to people self-quarantining. You bring up the excellent point of the vulnerable members of our community and how easily this virus is transmitted. Is it then concerning to you that President Trump thinks that a deadline, maybe less than 3 weeks away, is acceptable to reopening the American economy?
Well, I share our president's concern about the collateral damage associated with handling this pandemic. And I really do feel that his concerns are legitimate. However, I think he's being somewhat misguided, either by his advisors or by his failure to listen to those advisors that have medical expertise and scientific expertise, men and women like Dr. Fauci, who, throughout the medical profession and the scientific community is highly respected as an expert in epidemiology. And what our epidemiologists are telling us and what our infectious disease specialists are telling us really runs contrary to, I think, what is a very optimistic view by our president as to how quickly we can reopen our economy. Now, I realize that, just like oncologists every day have to make difficult decisions that we in medicine call risk-benefit analysis, where if a patient has cancer and is potentially facing a fatal outcome as a result of that malignancy, an oncologist has to make decisions about whether or not a certain chemotherapeutic regimen is appropriate or not. And even when that chemotherapeutic regimen could cause kidney failure or could cause heart failure, it's still considered an appropriate risk because the end goal is to save the life of the patient. Now, obviously, if the chemotherapeutic regimen were to kill the patient, then it would become a kind of a null hypothesis and it wouldn't go anywhere. Now, what our president, I think, is struggling with is the reality that in order to control this pandemic, all we have in terms of solutions or tools at this time include social distancing. Now, social distancing is not something that we only are limiting to those that are most vulnerable, because we understand that they can get it through those that are healthier. And that's the problem, is that in order to control this pandemic, we essentially have to shut down our labor force. We have to shut down all the folks that utilize our restaurants and utilize our coffee shops and our stores. And by doing that, yes, the necessary consequence of that is that the economy is going to struggle and it may be harmed. But if we are a compassionate people, if our humanity and our morality require that we save not only those that are already fit and strong, but those that are vulnerable, those that are weak, those that are elderly, I think that is a very difficult challenge that we're going to have to face. Now, I am optimistic and I have my own thoughts, even though I'm not an economist and I'm certainly not a politician. I have no ambitions of being either. I'm a medical doctor, but I have ideas, and I think there are others that will have even better ideas of how it is that we can try to segregate out those high-risk groups that we're particularly concerned about. For example, those over the age of 65, or those with significant comorbidities like diabetes, or lung disease, or rheumatologic disease, or autoimmune disease, or cancer. How do we take those populations out of the stream of commerce, so to speak, segregate them, isolate them, but allow those that are otherwise fit to go back to their jobs, to go back to kind of living life normally? I think these are big challenges that we're going to have to face.
Absolutely. Well, Dr. Zaheer Shah, it is your self-sacrifice that really makes the difference in all of this as well. So we really appreciate what you're doing on the front lines of this pandemic. Thank you for sharing your very personal, but also your professional expertise with us.
Thank you. Thank you for having me.
The worldwide death